So this evening, we have a speaker. Um, this is Tawney Spinelli, and she is a JD, PhD in clinical psychology at Northwestern University. Um, so I'm going to pass the mic over to her, and she's going to present to us tonight.
Hey everyone, thanks for having me in your class. I certainly appreciate the opportunity to talk about my research. So I wanted to walk you through a little bit about me, a little bit about what I do, and then to take you through one of the projects that my team and I have been working on. So today I'm going to talk to you a little bit about how to use research to improve systems and thinking about science in a little bit more of like a social science kind of way. So as the professor mentioned, I'm Tawney Spinelli. I'm at Northwestern University and I'm working on my law degree as well as my PhD in clinical psych. So the program that I'm in is Mental Health Services and Policy Program. And what we do is we try to look at system data, so big data, to answer questions that improve those services for the families that use them. These are some of the projects that we work on. I'm not going to read them to you. What I will point you to is that the projects that I tend to work on are projects with the Illinois Department of Children and Family Services. So our lab has all the data from every foster kid in Illinois, and we have the opportunity to sort of play and analyze that data. So it's 17,000 kids. And the other thing I'll say is that although we partnership with the Illinois Department of Children and Family Services, we also partner with national centers like the National Center for Child Traumatic Stress. Oh, yeah, great, thank you. So something else I'll mention, and part of how I got into this work is that I'm a former foster youth. And when I aged out, I got really involved in advocacy work. And that's sort of what drove me through some of the stepping stones that got me interested in these questions and then using science to answer the questions. So our agenda today is I'm gonna remind you the scientific method. You all probably know this better than I do, working in some of your majors are health science, biology. Some of the questions that we can then take that method and transpose it onto social sciences. I'll walk you through some of the questions that we have and the tests that we've done, and then some of our data conclusions. So here we go. No matter what we're doing, we really should be doing it in a way that's driven by data and evidence. And so how do we do that? Well, we first have observations. Those observations hopefully get us curious about something. We're able to follow those questions, make hypotheses, predict, test, and then use our results to inform that process and do it again and again. I get really excited about this because I hope to stay in this field and keep doing research. So some observations that we have through like reading, I would say, okay, so when I first started in the lab and even before that, the way that we make observations sometimes is through lived experience, right? Which is part of why I mentioned that I was a former foster youth. So sometimes we have these like lived experiences, this intuitive feel. Other times we can make observations through things that we're reading, maybe through other people's research, sometimes through talking to people. And so some of the observations that then led to the research that I'll get into today I was really curious about child welfare outcomes. And so you're going to see this acronym TAY a lot in my presentation today. And this stands for transition aged youth. And what does that mean? That means youth who are about the age that they're about to transition out of a system. So for our lab, that means, and in Illinois, the way Illinois defines it, is youth in foster care that are 14 and a half to 21. And at the age of 21 is when they actually transition out of child welfare in Illinois. Every state, this is a little bit different. And also this sort of word, this descriptor, crosses systems. So you can talk about someone that's transitioning out of educational systems or maybe intellectual and disability systems if they're receiving services as part of those departments. But for this presentation, it's just child welfare. And I want you to sort of think about like that later teen, adolescent, young adult years. So when we're looking at outcomes for TAY and child welfare, they happen to be not so great. So half of foster kids graduate high school, a little over half have their first child by age 19, repeat pregnancies also by that age. 37%, so a little over a third are homeless by or have experienced homelessness by age 23. We've got some lower, and you'll notice some of the dates of this. 2007, that was 13 years ago. It's still $9 an hour on average, not too great. Less than 5% of former foster youth graduate college. And then really any of the data that we look at, any of the research that we look at, we find that youth who are transitioning out of foster care have higher risk of negative outcomes across like all these different domains. And so our lab is like, okay, well, why? And we'll talk a little bit about it. So we have a theory that this could be driven by the trauma that's experienced, not only in foster care, but also before foster care, right? The sort of life events that land someone in the system, but then also what they experience in the system, and not just that, but this like unhealed trauma. And so when we look at how many have any of, well, I guess it would be hard for me to see, but there's one study called the ACEs study. It's Adverse Childhood Experiences, and the CDC took this up in probably like 5 or 6 years ago, based on a research study that was done in the late 90s. And it basically showed that the more types of trauma you've been exposed to, the worse your health outcomes are, the worse your mental health outcomes are. And so our lab started to look at this, like how many types of trauma had youth in foster care experienced? And then this specifically looked at transition age foster youth. And so what we see here is that transition age youth have a lot of trauma. I mean, to be 14 and a half to 21 years old, and, you know, over half of them have over 3 types of trauma that they've been exposed to. So not just one thing that happened multiple times or the severity of something, but just like a yes or no, have you experienced this? So then we started looking at the types of trauma that transition age youth have experienced. And we see neglect, we see physical abuse, witness to family violence, sexual abuse. I should have included this at the beginning of my presentation, and so I apologize for not doing this. A lot of my presentation talks about trauma, so there's a trigger warning. Please do what you need to take care of yourself. If you need to shut off your screen or take a couple deep breaths or go and get a drink of water, please do that. I won't be going into any specific forms of this. We'll just sort of be talking about the data, but I apologize for not talking about that at the beginning. So what we see here is that our youth who are aging out of the foster care system have experienced a lot of different types of trauma and a lot of trauma. And then what we started to wonder is, well, how does this trauma affect transition age youth, particularly at the point that they're transitioning? And what we see is that PTSD compared to, and for youth and child welfare versus not, is skyrocketed. It's at least double for youth that are in child welfare versus even when we compare based on lower socioeconomic status, even when we compare based on education or trauma, if you're coming out of the system, you're more likely to be diagnosed with PTSD. Additionally, when youth age out, there's a decline in mental health services. So the youth that are receiving therapy, maybe in the system, once they transition out, there's a decline in that. And there's a couple of theories about why this might be happening. One is that there's health insurance barriers. A lot of the Affordable Care Act that extended the age for foster youth helped with that a little bit. But there's also less structure. Youth who are transitioning out of foster care are often sort of dealing with other things of managing being an adult, often without a lot of support systems, parents, extended family helping them through those things. And then what we see too is that yeah, older foster youth have just higher rates of trauma. So the older the youth gets, the more trauma that we see, unfortunately. Let's see here. Okay. The other thing, so it's not all a terrible, grim, awful story. And this is part of what my lab focuses on is like, how do we, given what we know, how do we intercede? How do we build resilience? How do we look toward the things that could help youth at these critical points? And so we consider transitioning out to be a critical point. And what we find is that when we measure strengths, we find that even for youth who have high trauma, the amount of traumatic symptoms that they show will go down. So we find that youth who have higher strengths have more resilience. I hope I'm not talking in a bunch of jargon, but feel free, as you have questions, or if I say things that don't make any sense, like throw it in the chat, save your questions. Don't save your questions, throw them in the chat or save your questions. I want to make sure I'm answering those. Okay, so how does this lead to research questions in social sciences? Well, the big question here is, if there's all this unaddressed trauma that's contributing to these awful negative outcomes for youth who are transitioning out of foster care, then are there opportunities to sort of intercede across systems, and not just in mental health, because we know that the use of mental health services is declining. So are there other ways that we can kind of like infiltrate and help youth as they're becoming adults? And if so that's the big question, right? And like, how do we translate that into something testable? Which systems, which providers are the systems that youth are currently or naturally accessing? Are they already trauma informed, right? I feel like this is like a big buzzword now, like, oh, we're trauma informed. Like, what does that mean for providers? What does that mean for services? And then, oh, I have a little typo here. And then do youth and the providers that they're working with have a shared understanding of what youth strengths are, of how they're perhaps coping with their trauma, the mechanisms that they're using, their barriers, and any additional supports they could use, any needs that they have? Yeah, this is a great question. So some examples of strengths that people have, we tend to think of them as individual, community, and family. So if you have one adult that you're connected to, one positive adult influence that you're connected to, you are way less likely to show symptoms of trauma, and your outcomes, even apart from trauma, are way likely to be higher. Other things are having extracurricular activities, whether that's a job, whether that's I play sports, whether that's I like to bake. So outside interests are huge in building resilience. Having extended family supports that are positive are big. There's 10 of them that we measure. Optimism is one of them. So those are a couple. Those are 4. The other thing that we find are things like being connected to a community group. So a lot of times for people, this is measured in maybe like religious services or having like a religious outlet. So that's a big one that comes up a lot. How do health risks translate to higher ACE scores? Oh yeah, this is huge. If you Google this, you're gonna love it, because the CDC is taking this on, and so like the data on this is like mind blowing. So the higher your ACE score is, and it goes from 0 to 10, in incremental doses, you'll see that people are at higher risk for things like stroke, heart attack, high blood pressure. Basically anything that we can measure follows this pattern. You all have really, really good questions. Let's see here. Do mental health disorders have to be diagnosed, or can you usually self-diagnose? From a clinical psych perspective, I would say you should go to a mental health professional to be diagnosed. I would even say that medical doctors are not great at diagnosing. And a lot of times what happens is that there's certain things that kind of enter the layperson language. So like OCD is a big one. And as someone that studies this, people will be like, oh, I have OCD. And so that's something that like, as regular people in normal conversations, we talk about and we know what that person means. But do they have the clinical OCD diagnosis? Most likely not. And so I would, if you're having concerns or something like this, I would encourage you to talk to someone that is in the mental health field. What happens if the hurtful trauma, what happens if the harmful trauma happens once they're in the process of transitioning? Yeah, so this is huge. Trauma can happen at any point in our lives, and it can happen not just for youth who are transitioning out of child welfare. It can happen to any of us. And some of the numbers around ACEs show that 86% of people in the population, like general anyone measured, have experienced at least one traumatic event. And so this tells us that trauma is wide. It happens to a lot of us. And I would say that at these critical points when we have a lot of other stressful things happening in our lives, that trauma can be even more harmful. And part of the reason that I study this and I'm so interested in this is that your trauma is not your story. No matter what happens to us, humans have this remarkable ability to build resilience. And if we get the help that we need, if we are able to build in those supports and the things that can help us naturally, then recovery is possible. This does not have to hold anyone back. And I think that that's a beautiful part of the story. Great questions. So how do some of those things lead to hypotheses and predictions for like a scientific research study? Well, that big question, it's like, okay, well, my prediction is that surely, but which ones, which systems, what are the easiest ones that we can maybe tap into to start talking about healing of trauma? Across these systems, I predict that transition age youth are most likely to engage in educational services or vocational services. So think like employment, just because of that age, right? So like 14 and a half to 21 years old, you're probably looking at going to school or getting a job, right? And so those would be the two sort of next systems that I might, think about. And this is just thinking, right? Predictions are just like our thoughts hopefully based on other things, but sometimes we don't have anything to base it on and we have to go by intuition. And then what about the shared understanding? And this is interesting because with shared understanding, sometimes we're on the same page, right? And sometimes we're not. And so I felt like, and there's no data on this, I felt like providers and youth would be on the same page about some things and not about others. And I couldn't make other predictions about that. So how do we test these things? Well, what we decided to do to get some baseline understanding that would then catapult some other research is to gather data. And we decided to do focus groups and surveys by talking to the youth, right? And talking to providers. So for people with lived experience, we like to say nothing about us without us. If you're in a situation, if you're going into health fields and you want to work with infant mortality, please go talk to parents. If you are working in biology and you're studying cancer cells and you want to help systems implement better ways to treat cancer, please go talk to cancer patients. Like all of these perspectives will help what you're doing and help frame the answers that you have and how you implement your research. So we wanted in our field to talk to providers. We wanted to talk to admin, right? So providers can mean anything. It just means that you work in the field and perhaps provide a service. And we wanted to make sure that we were getting providers' perspectives from all levels. So we wanted the admin people, we wanted the top level people, we wanted supervisors, clinical, so people that maybe have a more of a frame on like clinical work, like mental health specifically, but then also direct services. So if you're in career services office at the university, like we wanted to better understand like what you were thinking too. And then geography, I think in Illinois, but also everywhere, geography is really important. If all of our perspectives are coming from Chicagoland, then that's not going to be as helpful for our Southern Illinois rural partners. And so we wanted to make sure that we're getting diverse perspectives. Okay, so we're about to do a little activity. Let me just pop over to questions real quick. Rachel, great question. I think people unconsciously seek out others who have similar events in their life? I do. I don't have data on that. There's probably data on that. What I think happens is that we tend to feel comfortable around people we feel like understand us. And I think what I would also say to that is that when we're open and we come to, other people from a place of kindness and curiosity, then it helps other people feel comfortable with us. And so this can kind of go both ways, right? Like if you're trying to like broaden your sphere and broaden sort of the perspectives that you naturally surround yourself with, I would say that a good place is to come from a place of curiosity, ask a lot of questions. Yeah, I like these questions. So feel free to keep throwing those in. I'm going to set up a little bit of how we tested this, and then I'm going to have some help throwing you all into breakout rooms. I don't want you to think no one's being tested on this. I just want you to sort of go through the activity that we had youth and providers go through. Then we'll come back together. I'll tell you what we found. And we'll keep going from there. So how did we test this? So first we got, this we only asked youth. So we got youth together. We got a bunch of youth. We got some providers all over. We did focus groups. So that part we won't go through together. But we asked youth about services that they're currently receiving. So do you receive any sort of like health services, educational, mental health, this other, we allowed them to define that. So what I'll ask you to do in your breakout rooms is to, and let me keep throwing the questions in here. I'm going to look through them as you all are in the breakout rooms, and I'll answer them when you return. So I'm going to throw a link to a Google Doc that has images of what I'm showing you. So I'll go through the instructions. Y'all hit a breakout room for about 10 minutes, and then I'll bring you back. So what I want you to do here is just guess. Guess how many of these 14 and a half to 21-year-olds were currently receiving any of these services, and then how many you think percentage-wise receive them in the past, okay? Don't spend too much time thinking about it. You can just guess. Then I want you to respond to these statements. There's 10 of them. And the point of this is just to sort of chat and think about this with your group, right? So maybe you all come to an agreement about the number. Maybe you don't. All of it's fine. If you want to just jot down your number, that's fine. If you come to a consensus, great. But it's more about just kind of talking about it. So transition age youth have the tools needed to cope with, I was adapting this. So there might be a couple typos, just forgive me, to cope with their trauma so they can be successful in adulthood. I want you to rate these statements on a scale of 1 to 5. So you'll have 1, 2, 3, 4, 5. 1 is you agree least with this. 5 is you agree most with this. There are services in their community. Sorry, I should have checked this twice. Services in their community. So we're thinking about transition age youth that meet the emotional and behavioral needs of transition age youth. And then just kind of go through these statements and see what you feel about them. You don't need to know exact definitions for any of these things. Just take the opportunity to think and discuss it, okay? Then these last couple of questions are just real quick, and you can discuss them as a group. Just 1 or 2 word answers, okay? So not like big things, don't write like paragraphs. 3 primary strengths, again, it was like 14 and a half to 21-year-olds. So 3 strengths of Tay, 1, 2, 3, done. 3 common coping strategies that you all would think or guess. 1, 2, 3, done. Don't spend a lot of time on this. Barriers or challenges, okay, for coping with trauma. And then the last one is, what 3 additional supports do you all think would help this group transition to adulthood successfully? Okay. It says we need access. Okay, let's see. See if I can give you access. Let's see. Does anyone want to throw in the fastest way to give you all access? It's so funny. You think you're ready and then make it public. Okay. What's the fastest way to make it public? Share. Can I just do anyone? Copy link. Anyone with the link. Okay, I think I did it. Do you all want to try again and let me know if it worked? Yeah, okay, I see y'all joining on. Okay, cool. So see ya. I'll catch you in 10 minutes and I'm excited. I hope you think it's fun. And a few. But for those of you that are back, do you want to throw in the chat your impressions about how that went? If it was hard or easy, if you liked it, if you hated it, any ideas that you had or impressions or... Yeah, that's fair. A lot of questions. Yeah. Shot in the dark about percentages for sure. More time for sure. Good point about Illinois. Some differences between states, yeah. Yeah, that's true too. It can be really hard to guess how people might be using services. Yeah. I think talking about it is a huge part of it. Good thing to do as a baseline. Good. Lowball the percentages. All right. Age range is difficult. Yeah, for sure. Good. Yeah. Do we know if most people are back? Everyone's back. Okay, great. So thank you for sharing those impressions in the chat. I didn't expect it to be an easy activity, but thank you for engaging in it. And yeah, I think even with more time, it would have been hard. But I realized that I threw a lot at you. I wanted to give you all a chance to discuss with each other and to think through yourself about some of those questions before I just sort of like threw numbers at you, threw percentages at you. So thanks for doing that and kind of playing along. Okay, so what did we find when we asked providers and youth these questions? So first with, and I think I'm doing this a little bit differently than I asked you to do them. But for the statements, when we were trying to figure out, and really we were using these statements to figure out where youth and providers agree, and to get a gauge of like which services they felt were already trauma informed, and then which ones which ones there might be opportunity for improvement. What we found that we weren't expecting to find here was how different providers and youth thought about these things. So number one here, I believe I have the tools. And so I pulled this one from the survey that we gave to transition age youth. I believe I have the tools I need to cope with my trauma so that I can be successful in adulthood. This was the highest ranked question for transition age youth. Providers, it was almost the lowest ranked question. And what does this tell me? What this tells me is that providers don't think that youth are equipped. And youth are like, I'm good to go. And so what is happening there? Like there's a huge discrepancy and like, it's funny, I say we a lot and I at one point could have been a youth and now perhaps I'm more of a provider, so I should just stop using that. But I think that as providers, like, are we not giving youth enough credit for the things that they've learned, for how much they know themselves and their ability to sort of ask? Are we using, when we say cope or successful in adulthood, is it hard to predict if you're going to be successful in adulthood when you're 14 and a half? So a couple things going on there, and definitely some generation of of questions, of more questions. And then we see with some of these that the rankings are pretty similar. So it seems like both providers and youth don't feel like resources and services are available or as easy to access as they could be. So that's a huge thing. And then there was one more discrepancy I wanted to point out here. Oh, educational setting. This was the lowest ranked for either providers or youth, that they believe that educational systems were operating from this sort of like trauma-informed lens. And that isn't a finger point or shame or blame education systems, but just to say that there might be an opportunity, especially if youth are engaging with those systems, to start bringing those things up. So we'll go to the next thing. I'll get to the percentage chart. It's the last thing, but just to give you an idea of how providers and youth answered this sort of three. And we asked, and it was real quick, give us 3 and 1 or 2 words. And these are some of the words that they came up with. And so for strengths, you see youth have, hardworking, self-advocacy, determined, intellectual, listening, independent, outgoing, caring. Providers, resilience is huge here. It was our #1 answer across the board, but also support and independence, driven, resourceful, adaptive, energy. So we see a lot of overlap here, I would say. When we look at the top 10 words for each, there's nothing here that like throws me for a loop. So hard comes from hardworking. We've got, reading, social, funny. For providers, because that resiliency, and I should have mentioned in the word clouds, the bigger the word, the more often we saw it in the answers. But because resiliency was our #1 answer, there's different types of the word resiliency, right? So, but also learning, independence. They found that their age was a strength. So providers were saying that the age of transition age youth was a strength. Common coping strategies. Now, this is one that definitely allowed us to really think about what was going on here and some of the discrepancies between youth and providers. So most of the youth responses were positive things. So music, talking, family, journaling, drawing, taking deep breaths, exercising, friends. Providers, the #1 answer was drugs, acting out, substances, avoiding. There was some counseling. There was a couple therapy, a couple more positively framed coping mechanisms, self-medicating, sexual promiscuity. We saw a lot of more negatively framed things here. So we'll put a pin in that one. The top 10 responses here, we have music, talk, walk, family, friends. On the other side here, we have providers. For providers, we have drugs, relationships was interesting. The idea that youth might be coping with relationships, acting, sex, violence, therapy, behavior, anger, alcohol avoidance. 3 common barriers we see here, a lot of overlap. So lack is huge in both of these. We see finances, trust issues, money, really like not enough services, not enough resources. Understanding was interesting here from the provider's viewpoint. I was really surprised to see that transition age youth said people were a barrier, which makes us think maybe unhealthy relationships, maybe providers limiting access to resources or trying to navigate those systems without perhaps support. So things that allow us to give a little bit of a deeper dive. Here you can see the top 10 words again. A lot of the things I've already mentioned. Job came up as a barrier. Bills. When we're talking about additional supports here, we see some of the same sorts of things. A lot of like people and money and resources, right? So friends, family, money, education and college, supportive people, parental figures, best friends, children. For providers, mentorship came up, and the idea that something that might help youth transition into adulthood successfully would be to have a mentor, to have someone that is sort of crossing this line of, or in a good way, of being like a friend or a family member, someone that's able to mentor the young person. Education came up, so that was similar. Opportunities, training, things like this. So if we look at the just sort of the top 10, we see family, money, friends. We see support services, education. And feel free to throw, I'm keeping an eye on the chat. I'm almost finished. I'll pop back to that in a minute, but feel free to throw any reactions in there too. Anything that surprises you, anything that you're like, oh yeah, well, of course that's in there. All right, so then we plotted all of these together, and we said, okay, out of how many providers on the bottom said a thing, and how many transition age youth said it on the left-hand side here. So things that were toward this dotted line were things that both youth and providers were saying. So financial was coming up, coping was coming up, anger, skills a little more. Things that a lot of providers said and zero transition age youth said were things like drugs, relationships, although relationships is interesting because the way that transition age youth talked about that was family, people, friends. So that had an overlap, even though they were maybe using different words. But what that alerts us to is that maybe they're using different words. And sometimes when we use different words, we're talking past each other and not with each other. And then here is our percentage of currently receiving and past receiving. And something that surprised me here, and really the reason that this question came about was to figure out what systems we might be able to sort of infiltrate in a good way to talk about resilience and building resilience and healing from trauma. So you see that health and education, health services are, going to the doctor, preventative services. Education services, so that might be college services, it might be GED services, it might be finishing a high school diploma. Mental health is typically therapy, from what our youth were telling us. Financial could be like financial independence classes, things like this. And then I should remember what other was, and I can't quite remember, but I'll get back to you if you really want to know. What I was most surprised about here was that very few of our youth were connected with substance use services, particularly because providers said that this was the most common coping mechanism and was a huge barrier. And so what this sort of tells me is that there's a disconnect. Either providers are saying this and then are uncomfortable, or they're not making those connections or those referrals, or there's some sort of other accessibility issue, or providers are recognizing it and are like, nope, sorry, that's not actually what's going on. So what do we do with this? And let's see, I have maybe like 5 more slides, and then I'll pop back and answer all your questions. So communication, it's important when you do any sort of research, any sort of study, to communicate what you've learned, because if not, you're just sitting on it and other people can't use that data to, improve things. So that's part of why communication is so important. Next, perhaps using that to think about recommendations or pass it off so someone else can make recommendations. What's working, what isn't working, what was surprising, what was not surprising. And then there are different ways of communicating, right? Things like this, presenting, discussing, talking about it. That can be formal, that can be informal, that can be with friends at, coffee shop or what over lunch, or more formal, a presentation. Can also be publications, right? This map that you see here, every blue dot represents a transition age youth in Illinois. All right. So next steps, just like our scientific method, we use these things to inform the next step. And so the idea is that these generate additional questions and more questions so that we continue to keep filling in these gaps. And so how are we doing that? Well, there are lots of, as you all saw, some commonalities and differences. So exploring those and figuring out how we can use those commonalities commonalities to our advantage, and also figuring out why there's differences. So to pull out substance abuse specifically, are providers overestimating how much, that 14.5 to 21-year-old age group is using substance abuse or using substances compared to their peers? Are they sort of overestimating that this is like a huge problem, when maybe it's not? Are they discounting sort of this idea of like self-medication? If we're feeling anxious or we're feeling depressed, maybe we have a drink or we smoke a little, and that's sort of the idea of like self-medicating. Are we adequately comparing groups of youth that are like maybe involved in child welfare and then youth that aren't? That age group is sort of the time when using and experimenting with substances goes up. It's the highest, time to do that. So perhaps our comparisons are a little bit off. So just sort of continuing to explore this. Just a little reminder. And then I'm going to go and pop over and see what questions you have. So I don't want to get lost. There was a question in here before we hit the breakout rooms. How do you deal with contradictions in people's perspective between different providers? So that was a question from before. How would I recommend, how would I personally deal? I mean, I would recommend second opinions. I mean, the number one, and perhaps this is related to therapy, or I think in that space where you're kind of talking about some diagnostic stuff. There's a lot of therapies out there, and there's a lot of effective therapies. And still, the number one factor that determines whether or not therapy will be effective for any one person is your rapport, your relationship with your therapist. So if you start some sort of counseling or other service, and you're not feeling it with that person, give it a session or two. The first sessions are always weird. But if you're not feeling it, just find someone else. It's like no big deal. And so if you're feeling this like contradiction in people's perspectives or from different providers, I would encourage you to find another provider, get a second opinion. If a diagnosis isn't sort of sitting right with you, perhaps it's because it's not right. Like, you know yourself better than anyone. And perhaps it's maybe you know something that you're not saying and that affects your diagnosis or something like this. So that's how I would answer that question. Okay. What institutions have I visited? Can you be more specific? Like with this research study in Illinois, or I'll let you chime back in with a little bit more there. How does having a law degree tie into my work? Yes. And also I'm going to push, I just want to say thank you all. And my email is at the bottom. So if you do want to reach out, if you have questions or what have you after this, I'm happy to engage in those conversations. For me, the law piece of it is legislation and system policy. I think that we're starting to know, we continue to research trauma and clinical psych. The people that are making those, often the people that make laws and policies for departments, for our state, don't know as much about trauma as we do in like clinical psych. And so how do we bring those policies in line with what we know about resilience and trauma and help people grow and really benefit from those services? I think also sometimes our systems, hopefully not intentionally, are adding to that trauma. And so how do we prevent that? So for me, that's how the law ties in. What positive qualities do I think are linked to experiences in foster care? I'm so happy you asked this. I think it depends on the person, right? Like, we all have strengths. We all have opportunities for growth. For me, I think maybe in myself, and then in a lot of the former foster youth and foster youth I've met, incredibly resilient, incredibly strong, able to think outside of the box, very adaptive, able to sort of like take what life throws at them and move with it, because that's sort of what they've had to do. And so I think that those are just some of the top ones that come to my head. How many participants were part of our questionnaire? So we this is a great question. We had about 40 youth that we got from, or that we were able to engage with from across the state. It's hard. You may or may not be surprised by this. It's hard to get permission to talk to youth who are in foster care that are under the age of 18. And so we had to wiggle a little bit with that. With providers, it was close to 90. I want to say it was like 89, something like this. Were providers or Tay more accurate about the types of coping mechanisms? I think they're both accurate. I think we talk about coping in different ways. We use different language for this. And so I think everything that everyone said was a type of coping mechanism. I do think that when people are being asked personally, and we didn't go to Tay and say, how do you personally cope with trauma, right? We said, like, how do you think this group copes with trauma? And they said, well, you saw their answers, so I won't go into that. But I do think something that we sort of do as providers is that we talk about coping mechanisms in one way. So we say, here are healthy coping mechanisms: reading and writing and exercising and journaling and spending time with your friends and listening to music. And what I think gets lost is that we're not talking as a society, maybe, about the unhealthy coping mechanisms that people use. And so do I think that transition age youth who cope with alcohol are any better or worse than law students who cope with using alcohol? No, it's still a negative coping mechanism that we're using to deal with stress, trauma, anxiety, depression. So that's what I would say is kind of going on there. What do I think is the most common barrier? These questions are so good. Let's see. I'm gonna do a little time check. Okay, I'm gonna go for 3 more minutes. Is that? Yeah. I know you all have a lot of announcements too. Okay. Is that okay? Thumbs up. 3 minutes is cool. Okay, cool. I'm just having too much fun. This is the problem with me. Okay. Positive qualities. Sorry, I lost my space, y'all. What do I think is the most common barrier struggle for Tay based on research? I would say transitioning out of care. It is very abrupt. A lot of youth, especially if they're in group homes or some sort of like residential mental health facility, they're not allowed to prepare their meals, grocery shopping, laundry, any of these things. And so a lot of them are like thrown out into the world, and in ways that like we could prevent, we could help instill some of what we call independent living skills. So I would say that's a huge barrier. And then I would say that like a lot of times, like, you know, things that some people can call their parents for, or whether it's money or whether it's like, hey, I don't know how to use a crock pot. They don't necessarily have that. And that can be really, really hard. So I would say that those are the two. Does all this information presented percentages encompass LGBTQ as well? Are there differences? This is a great question. I'm so happy you brought this up. These do encompass. However, if you take transition age youth if your sample is only LGBTQ plus transition age youth, unfortunately, they're at even higher risk for all of the things I've talked about today. Another thing that makes it really hard to study is that a lot of times, and this happens with race too, and I hope you all are included in that, can change some of these things, is that the way that the department collects this data, Department of Children's Services collects this data, is that a lot of times they don't even ask the kiddo. They look at them and they mark male or female and they mark race. So there are these like weird categories that do not encompass. Oh, I just saw my 5-minute warning. Thank you. Okay, I'm going to do 2 more. Oh, good. We basically only have 2 more, so it's great. Institutions in Illinois. So I think we went to a couple group homes to talk to transition age youth. We also talked to youth who had transitioned out that were part of like youth leadership boards. And then providers, we went through the department, and any outside provider agency that worked with transition age youth, we invited them to a meeting, a couple of meetings actually. So that's how we got there. Is it true that people who experience trauma, that their mind tends to forget hurtful parts and harmful things? Is it true that those who heal interpretation of the trauma has been suppressed and reshaped? Okay, this is a perfect question to end on. So I'll tell you a little bit of what I know about the neuroscience of trauma. Trauma is wild, and trauma impacts everyone differently. And this is also why I'm just so curious about it, and why I think studying it is really important. So what happens when someone undergoes trauma is that it actually bypasses the verbal part of your brain, and it encodes in other parts. So it immediately turns on your amygdala, which is your fight or flight response. And you start producing like tons of like cortisol and norepinephrine and like stress hormones, which turn on this like survival mode. So yes, like I would say that not just your memory of the particular event, but all the events around it start to be really scattered. So this is a huge problem, and we're trying to get police departments actually to think about the way that they interview victims or survivors, because unfortunately a lot of times from what we know, it's really hard to get a chronological narrative of the thing that happens in a way that like other stressful but positive events, think like when you get married or like something like this, having a baby, like those are stressful, but they're often more positive, and you're able to remember in a chronological order. So trauma doesn't do that, and it can be hard, and it affects different parts of the brain in different ways, depending on, you know, who you are and what your brain structure is before and during and after. And yeah, I would encourage you all. It seems like you all are really interested in this. Check out ACEs. So thank you so much for having me. I really appreciate it. This has been awesome. Thank you for being engaged and for you know, playing along with my activity, and just having me today.
Thank you so much. That was a great presentation. Everybody was obviously very enthusiastic about it.
Well, thank you all. Good luck with the rest of your semester, and, you know, feel free to email if you have any questions. All right, cheers.
Thank you. Enjoy
Thanks, bye.